Avoid stimulants if you're having anxiety. I'm Dr. Melissa, a family lifestyle integrative psychiatry doctor, and it's so important if you're feeling overwhelmed, stressed out, in a panic, and even a fast heart rate to avoid stimulants. Stimulants come in many forms. It can come in the form of caffeine and nicotine. Often these are found in foods, supplements, and drinks. So make sure that you slowly come off of them and get some help. You want to definitely check your medications as well, because over-the-counter medications such as cough syrups, decongestants for colds often have things like pseudoepinephrine or phenylephrine. Both pseudoepinephrine and phenylephrine can raise your blood pressure, your heart rate, and even your anxiety levels. You want to look at your other medications such as thyroid medications and make sure you're not over or underdosed. Another common medication that can cause palpitations is asthma medications such as albuterol. Albuterol can cause palpitations and feel like your heart is racing. So make sure you take a slow, deep breath, get assistance, and know what to expect. There are certain medications like anxiety medications or antidepressants can alter your heart rate. So it's important to know what comes first, the chicken or the egg, because sometimes it can cause further imbalance. So make sure you're not just taking medication from a friend, but taking it from a doctor who is aware of the side effects or benefits of the medication. So it's important to know if you have any of these medications to discuss it with your doctor. Don't just stop it if you're having palpitations, but find out why. That's why I practice root cause medicine, integrative lifestyle medicine, to get to the root cause. Another group of medications that can cause palpitations or increased heart rate are blood pressure medications such as Lasix or some type of diuretic, because you're losing fluid and you're also increasing the heart rate. Another group of medications are certain antihistamines, especially Benadryl. Benadryl is a medication that can cause increased palpitations, but also cause people to hold their pee and hold their stools. So if you're overdoing it on the Benadryl, that might be a cause of why you have palpitations. Another group of medications are steroids. A lot of prednisone or steroid medications can cause palpitation. Often it can cause increased blood pressure, heart rate, blood sugar, and even depressive, anxious symptoms. So make sure you get some help if you're experiencing increased palpitations or anxiety. Certain antibiotics or antifungals can increase heart rate or palpitations. Azithromycin can often cause arrhythmias if mixed with certain medications, or if you already have certain arrhythmias or irregular heart rate. Fluconazole is an antifungal that can potentially cause palpitations, so make sure that you're not taking it for a long period of time. Another group of medications that causes palpitations are weight loss medications. Phentermine can increase heart rate and cause increased anxiety and stress. Another source of increased heart rate or palpitations are birth control pills, hormonal pills that you may not be used to or not at the adequate dose. There's always alternatives, because oftentimes birth control is mixed with other types of ingredients, so make sure you're finding bioidentical hormones or working with a doctor who can assist you. If you learned a lot today, follow me at Dr. Melissa's Kitchen. I'm also in my clinic at Dr. Lifestyle, where I help solve all the symptoms and medication supplement questions that you can't just find on the internet. Share your questions below, like, follow, subscribe, and we'll see you next time.